Okay, hello, my name is Kyra McCullough, and I'll be talking about opioids. What are opioids? Opioids, according to Hopkins Medicine, are a class of drugs naturally found in the opium poppy plant. Some opioids are made in the lab or just made from the plant. These drugs are often prescribed medications known as painkillers, or they can be found in the streets. So there are several types of opioids: codeine, fentanyl, hydrocodone, methadone, morphine, oxycodone. So on the right hand side, there are all the different types of opioids and what they look like. So some history on opioids. So in the late 1990s, pharmaceutical companies led people and physicians to think that opioids were not addictive and that they were not harmful, but this was not the case. Many physicians believe that the pharmaceutical companies, so they started to prescribe opioids to their patients. This led to many opioid overdoses and addiction. So opioids tend to be misused and abused. So according to the CDC, 70% of the 67,000 deaths in the year 2018 involved the use of opioids. Most people are not aware of the opioid epidemic and how fatal opioids are. Every day, 128 people die from opioid overdoses. This may not seem like a lot, but it is. This is not just a problem for adults, but older teens and young adults between the ages of 12 and 20 are affected by opioids as well. Many teens take opioids to feel relaxed or high, which leads to misuse and abuse. So there's a lot of opioid addiction going on all over the world. Addiction of opioids usually starts after a patient goes through surgery and they are prescribed opioids for pain medication. What happens is they get addicted to taking them after surgery, and it becomes harder and harder to stop taking them. Once an individual's body gets used to them taking opioids, the body starts depending on them. As a result, they start to take more and more, which leads to addiction and dependency. So opioids have different effects on the body. So that what happens is the opioids affects the neurons in our brain and in our body. These drugs send messages to our brain to stop pain. Opioids also cause us to have a euphoric and calm feeling. Some short-term effects are calmness, confusion, nausea, slow breathing, and drowsiness. Long-term effects are addiction and dependency. And addiction can lead to withdrawal when you're trying to get off the drug. And withdrawal has several different effects as well, such as like nausea, pain, all different types of effects. So here's a picture of the effects on the body. So opioids do not only affect your body, but like your body as a whole, but it affects your brain, your heart, your liver, just everywhere in your body opioids can affect. So the solution to opioids, the opioid epidemic. So we need to improve access to drug addiction, treatment, and recovery, inform individuals how dangerous and addictive opioids are, provide research to how addictive and dangerous opioids are, promote other options to manage pain, and instead of sending individuals to jail, we should help them get support for their addiction, such as taking them to rehab, helping them go see counselors and stuff like that, rather than just giving them consequences for their addiction when it's really a sickness. So thank you for my presentation.